I was playing on the floor in my room with my grandson, who was 1 year old at the time. And all of a sudden, my hand was like a claw. I couldn't get it to move, and I thought, well, that's weird. I tried the left hand, and that was working. So I thought, well, I'll get up and call my son and my daughter-in-law. And I couldn't walk. I couldn't get up. So I dragged myself to the door, and I pulled myself up, and I tried to call my son. And I didn't recognize what I said. And then I knew I was having a stroke.
Usually I would have been outside working on something in the shop. I just wouldn't have been in earshot of my mom calling for help, which was a feeble call. It wasn't loud.
Luckily, my son was home, and he came and he thought something was wrong with the baby.
She was laying there. The baby was near her, and she had this scared look on her face. I don't know what she said to me, but she wasn't talking right.
And then I'm trying to talk, and nothing, gibberish is coming out. And he looked at me and he said, "Are you having a heart attack?" And I tried to say a stroke, but I don't know what came out.
I knew something was wrong, and I just picked her up under her arms, and I just picked her up. Literally, it was 10 minutes later from the time she called me that she was going into the emergency room. It couldn't have been any faster unless we lived across the street from the hospital.
Well, it was just a normal day, really. I did some work, and I was clearing my desk, and my right thumb and the next two fingers went numb for about 4 seconds. And then it cleared, and I thought, well, that's strange. And then a spot above my elbow did the same thing for about the same length of time. So I turned to my husband to say, something weird is going on. And all I could say was, Ida, Ida, Ida. And I thought, oh gosh, I can talk. What is this? So I try again, and same thing, just Ida, Ida, Ida. That's the only thing that would come out. So this happened, the whole thing happened like at 2 in the afternoon, and within 5 minutes we called 911. So I mean, I was in immediately.
Those patients are immediately brought to a room, vital signs are taken, and the emergency department physician gets to the bedside within a few minutes to initiate the evaluation. If that quick history and evaluation examination are highly suggestive that a stroke is occurring, a rapid sequence of events occurs.
There's a physician, a couple of nurses, we get an EKG right away, obviously radiology with the CT scan. It's really a team effort. It's everybody in the department is involved in taking care of them and making sure that we get them taken care of as quickly as possible.
So this is a time-sensitive emergency driven by the fact that the sooner blood flow is restored, the less the brain tissue loss is and the better the outcome.
They took her in and they started doing all the tests, and then they offered her that shot, the clot buster. I asked if that lady would give it to her mom. And she said she would in a heartbeat, so we did it.
Somebody can come in and they're not able to speak, maybe one whole side, they can't move it. And then by the time we move them up to the critical care unit, they're talking to us and they can move again. And so it's a pretty miraculous thing to watch.
I was in the hospital 3 days, and I went to rehab, and I was there for a week. And by the end of the week, I was walking, but I was determined because the look on my grandchildren's face, I wanted to get better for them.
Really, the whole team's goal is to get patients restored to their prior level of function and restored to the things that they loved to do before they had a stroke. If we're not able to restore them completely to that, giving them tools to adapt those things, adapt their environment so they can be successful, and then teach them how to compensate to do those things that may be more challenging for them. We have a gym space dedicated to our patients with neurologic diagnoses such as stroke that provides a more home-like environment. So, we have a bed set up, a couch, a recliner, more open space so that we can work on balance activities.
I had good nursing care. I had a family that cared and supported me, and I had so many people praying for me. I'm just so grateful to God and to everybody that I really am as healed as I am.
It happened in the evening. I knew that morning, I knew I was going to be okay. I could just tell, you know, the medicine, it just really kicked in. I got out of the hospital Thursday and I went back to work Friday. And I went to church Sunday. Everybody was amazed to see me because they'd all been praying, and you hear the word stroke and you automatically assume the worst.
I was just truly, truly lucky that I had been active before. I got the shot in time. I had great care. I had great support, and that's important. That's important.
Every single nurse was nice and helpful. Lots of care, genuine care.
And those people were really nice. No, everybody was wonderful.
Kootenai is the best hospital I've ever worked at. And I don't say that just because I'm working here now. It really, honestly is.